typical things of the mummy makeover, it's going to be the type of patient and obviously what they normally come in worried about. So usually it's a woman who's had their kids already, and they're not in their early 20s, but they're sort of in their late 20s, in their mid 30s up to their early 40s. But certainly no specific age range, but it's usually women who are postpartum, who've had kids. And generally speaking, the two main areas that they're concerned about, their breasts and their tummy. In terms of the breasts, oftentimes their breasts have been at a size that they've been really happy with, especially when they're breastfeeding and the milk comes down, and so the skin gets all stretched out. But then once they've finished breastfeeding and the breast tissue shrinks away, the skin doesn't retract back in a nice elastic sort of way, and so you get excess skin, and that's a sign of normal breast aging to a certain extent, where you have a bit more droop and a bit more sag, and then the nipple can sit in a lower position, and so that's a marker for aging. Whereas a youthful breast, the nipple sits in a higher position, and you don't have the same degree of sag and droop. The other area is the tummy, and so that's where you've got excess skin that can, in bad cases, can look like a prune, in some cases, because there is so much excess there. And no matter what people do with exercise and tightening and toning and Pilates and yoga and all the rest of it, it's still going to look like that. The other issue with the tummy is that weakness in the tummy wall, so the separation or divarication of the rectus sheath, which just means that the fascia that holds the six-pack muscles together gets stretched and widened, and so that weakens their core body strength and gives that tummy bulge. So they're the two main areas that most women are concerned about with a so-called mummy makeover. So when I think of mummy makeover, they're the things I'm thinking about: breasts and tummy by and large.